Time now is 6:35, and joining us to talk about the latest coronavirus questions is Dr. Glenn Goldis, the Chief Medical Officer for Kern Medical. Dr. Goldis, thanks so much for joining us this morning. Really do appreciate it. I want to talk first about the updated news regarding vaccines. It seems like every time you join us, there's something new to talk about. I want to specifically talk about the advisory panel to the FDA that met yesterday, talking about who is going to get the vaccine first here in the United States. They say that we are weeks away from distribution, which is definitely good news for a lot of people. I want to ask you, though, who is going to get those first doses of this vaccine?
So the advisory panel to the FDA recommended some refinement to their Phase 1A recommendations, and it essentially includes healthcare workers and nursing home patients, which is about 24 million people. That healthcare worker group is comprised of hospital workers who are in direct contact with patients that have COVID, outpatient clinics, home health care workers, pharmacy workers, emergency medical technician personnel, and public health workers. And then that long-term care facility group, that 3 million individuals who reside in skilled nursing facilities or assisted living facilities or other residential care, are also included in that Phase 1A group.
So for people who do not have any pre-existing conditions, they're considered healthy. They don't necessarily, based on what the information that we know from the CDC and so forth, they are considered people with low risk of any serious side effects with this virus. When are those people going to be able to get this vaccine? Is it going to be several months away?
Oh yeah, it would be at least spring, if not summer.
Okay, so is it possible for a vast majority of Americans to be vaccinated by late spring, early summer?
That's what we're hoping for. Of course, a lot of this depends on operationally how quickly we can roll things out and how quickly the approvals come and the distribution happens. There's a lot of work going on in preparation for that. And of course, we want to make sure people participate and choose to receive the vaccine.
Now, I know that might seem like a long ways away, but at least there is a light at the end of this tunnel. We're talking about possibly having everyone, or at least giving people the option to get this vaccine by early summer, late spring, early summer, which is definitely good news. But that leads me to my next question. How long are we going to be dealing with this virus?
Well, the pandemic itself may last a while. You know, there's a statement made by the head of the World Health Organization back in August, where he felt that the pandemic would actually last 2 years. Now, that's interesting, given that the 1918 flu pandemic also lasted about 2 years. Today, of course, we're more technologically advanced and we're also more globalized, so it's much easier to spread virus around the world. So in all likelihood, yeah, this pandemic will continue for many months to come, and will rest largely on safe practices by individuals, as well as the ability for us to get the population immunized.
Yeah.
So yes, continue precautions, very important.
You know, I know that at the beginning of this thing, I remember back in March when we really did not know a lot about this virus. I remember the guidance changing every couple of weeks, it seemed like, as new information was coming through. But I got to ask you, we're in the thick of this. We've already seen one surge. We're starting this second surge here locally. Are doctors able to treat patients better than they were just a couple of months ago?
I'm sorry, you cut out in that last part. Would you repeat the question?
No worries. Are doctors able to treat patients with more severe symptoms better than they were even just a couple of months ago, back with this first surge?
We are. There are more treatments now than we had back in March. We originally had convalescent plasma and dexamethasone, which is a steroid. Now, of course, we're working with remdesivir, and we have this exciting opportunity to use these new monoclonal antibodies, which were recently granted emergency use authorization. Now, there's different subsets of patients who benefit from these various treatments, but we have more now than we ever have.
I've got to ask you really quick. You know, we're in the thick of this. We're talking about the second surge. We're just a couple of days away, or a couple of days after Thanksgiving. When are we going to start to see the effects of the Thanksgiving holiday and that holiday when a lot of people typically gather?
Yeah, we're actually beginning to see it right now. You know, the CDC recently shortened their length of quarantine recommendation after exposure from 14 days to 10 days. And the reason why they did that is because that incubation period is now realized to be pretty much less than 10 days. So if you're going to become symptomatic, it's going to happen typically within 4 to 5 days after the time of exposure, and that's right now. We are, in fact, seeing more tests coming in positive just in the last 2 days, and as you can tell from the county numbers, they are continuing to rise.
We are really low on time. I got to ask you there really quick because a lot of people are asking this question. We know that a lot of people, a majority of people recover from this virus, and we talked about it yesterday that only about 10% of people who are infected with this virus are actually hospitalized. So we're still talking about low numbers. So with all of these precautions in place, with all of this, it talks about possibly another stay-at-home order and all this stuff, why are we doing all of this right now when we know that a majority of people do recover from this virus?
Well, it's great that the majority do, but yet the 10% that don't are actually still a serious public health issue. It's still no joke when you get the disease because it's miserable during the time you have it. And of course, those who expire from this or otherwise hospitalized and sometimes just near death, they have just a horrible experience. And as I mentioned briefly yesterday, there may be some long-term residual effects once you recover from the virus, including some compromise of lung function, depending upon how much inflammation you had to endure during the course of your illness. So again, it's not anything to be taken lightly, and all these precautions that we're taking now are for good reason.
All right, Dr. Goldis, thanks so much for joining us this morning. Really do appreciate it. We'll see you in the coming days.
Thank you so much.
All right, we're back.